Hi guys, welcome. This is PLP discussion of COVID-19 capitalism and public health. I'm going to bring Sai up to do a proper introduction here.
Hi, everyone. All right, we'll just go ahead and get started. Welcome to this program from the Progressive Labor Party on COVID-19, capitalism, and the need for revolutionary change in our society. The Progressive Labor Party, as many of you know, is a communist organization dedicated to the fight against racism and towards the formation of an egalitarian communist world run by the working class, the 99% instead of the 1%. The imperative for revolutionary structural change has once again been revealed by the COVID epidemic and the persistent violence on Black men and women, most recently George Floyd, for whom we grieve and rally for in uprisings around the country once again. These deadly inequities and deaths hurt us all, but some much more than others, of course. Reforms and voting do not cure the multiple pandemics of unemployment, disease, and poverty, but a communist society that improves on past mistakes can. We will be starting with the slideshow from the Health Collective of the PLP, followed by a discussion and audience comments and questions, which you can post in the chat. We'll also post contact information there so that you can connect with the Health Collective and the Party Study Group. We also wanted to let you know about a rally that's being organized by Community Justice, which is a grassroots anti-police brutality group in PG County, or Prince George's County, in order to protest the murder of George Floyd and similar murders in the county, specifically those of Leonard Shand and William Green. It's going to begin at 5 p.m. tomorrow at the Eastover Shopping Center, which is located at 5135 Indian Head Highway in Oxon Hill. I can post the address in the chat in a minute if that's helpful for other people. But for now, we'll go ahead and get started with our slideshow called Capitalism is the Virus, Communism is the Cure.
Capitalism is the virus. Communism is the cure. Progressive Labor Party produced this presentation around May Day 2020 during the rapidly unfolding coronavirus pandemic. Many of the facts will be out of date by the time you watch this, but the central ideas remain. The need for the international working class to seize power is a matter of life and death. Every person alive today is witnessing events that are unlike anything we've ever lived through, unlike anything most of us have ever imagined. However, the solution to the life and death crisis is too often dismissed as impossible. Rosa Luxemburg said, "Before a revolution happens, it is perceived as impossible. After it happens, it is seen as having been inevitable." History shows that revolutions do in fact happen. There were two major ones in the 20th century. Based on the experiences of earlier revolutionaries and on our own experience in struggle, we in PLP understand that revolution, though not inevitable, is definitely possible and necessary. The COVID virus, like all previous viruses, is a product of nature. But deforestation and industrial methods of raising animals are products of capitalism. These changes have led to more frequent human encounters with novel viruses, some of which are deadly. The increasingly frequent pandemics were created by the capitalist system. For years, conservative and so-called progressive leaders alike talked about preparing for a pandemic. Today, the millions of infections and hundreds of thousands of deaths we are seeing worldwide show the results. They talked a lot, but they never actually made preparations. The billionaires and bankers view healthcare as a source of profits, not a public good. Health and sickness in the United States has always had a profoundly racist aspect. From Dr. J. Marion Sims' experimental gynecological surgery on enslaved African women before the Civil War, to the 20th century U.S. Public Health Service's secret syphilis experiments on African American men. Racism has been a defining characteristic of life and death in America. The gap between Black and white life expectancy and infant survival is appalling and getting worse. In 1950, a Black baby in the U.S. was 1.6 times as likely as a white baby to die before his first birthday. Today, the Black baby's chances are even worse, with death 2.3 times as likely. In the U.S., healthcare peaked for workers when the mass anti-racist struggles of the 1960s and 1970s established Medicare and Medicaid. Since then, healthcare has worsened under every president since Reagan. At least 170 U.S. hospitals have been closed in the past 15 years. During these decades, the wealth gap between the bosses and workers has also widened. How would a communist society respond to a pandemic? Communism is based on sharing. Communism puts the needs of the working class first and relies on the working class to understand and conquer diseases. With the working class running society, we will provide everything needed to handle medical emergencies. The old communist movement established socialism, which they viewed as a stage on the road to communism. The experiences of the Soviet Union, China, and Cuba provide us with a glimpse of what is possible in a society run by and for the working class. Even though they didn't achieve the true equality they hoped for, these post-revolutionary societies were able to develop cooperation and collective values to a level never before achieved. Communists in the Soviet Union and China made amazing strides in health during their socialist periods. Both countries focused on disease prevention, education, and mobilization of the working class to combat disease. They instituted universal free medical care and massive public health interventions immediately after the revolutions. For a few decades, both of those revolutions succeeded in quickly improving health. The Chinese wiped out syphilis by 1980 with a mass education campaign. Workers were taught how syphilis is caused by sexism, other exploitative ideas and behaviors that were part of the hated feudal and colonial past. Communists abolished prostitution and child marriage and equalized women's access to employment and to divorce. Life expectancy at birth soared. At the time of the Russian Revolution of 1917, life expectancy was just 30 years. By 1940, it had doubled to 60 years. In China, similarly, life expectancy was only 38 years at the time of the 1949 revolution, but in just a few decades, it increased to 65.5 years. Sadly, many of these gains were reversed when economic and political power ended up in the hands of a new capitalist class of bosses and bureaucrats. Russia and China are both capitalist countries now. The new class of billionaires in China has emerged along with a huge gap between rich and poor, resurgence of the sex trade, and a syphilis epidemic by the early 2000s. Still, the experience of collectivity and cooperation are a legacy of the early years. In China, where the coronavirus originated, the response of the population to the strict quarantine imposed by the government was generally one of cooperation. Everyone from medical personnel to food delivery workers threw themselves into the fight. As a result, most COVID-19 deaths were confined to Hebei province. By May 1st, 2020, the total death toll in the US was over 10 times as high as the death toll of China. and the US has less than 1/4 of China's population. COVID deaths in the US are still rising at an alarming rate as these lines are written. Cuba, which has universal free medical care and where racial discrimination has been illegal since 1960, has also mobilized the population to bring COVID under control quickly. As of mid-April, they had only 21 deaths in the whole country from COVID. What's more, Cuba, which has the highest number of doctors per capita of any country in the world, has sent COVID medical teams to volunteer in South Africa, Italy, and dozens of other countries. Today, the racist profit system is more deadly than ever, as this new virus infects Black and brown people disproportionately. Black and immigrant workers more often can't work from home, but instead ride crowded subways to work the hospitals, stores, and warehouses. Thousands of Latinx immigrant workers work the fields and staff the poultry and meatpacking plants with no safety precautions in place. These super-exploited and oppressed workers, once infected, are much more likely to die. Black and Latinx workers suffer high rates of chronic diseases like diabetes and high blood pressure brought on by the stress of living in a racist society. In Chicago, where Black people make up only 30% of the population, they account for 70% of the deaths. Similar statistics have been reported in New York, Milwaukee, and other cities. As the pandemic spreads to poorer countries, the death toll is horrifying. In Guayaquil, Ecuador, there are lines of coffin-laden vehicles outside the cemeteries. Bodies in plastic bags are left on the streets. In Africa, there are many fewer hospitals, almost no ventilators. Millions can't access clean water to wash their hands. As of May 1st, Africa was still only reporting a few thousand cases, but the UN estimates there could be 3.3 million deaths once the pandemic takes hold there. The capitalist system created today's living hell with racism, sexism, evictions, deportations, police terror, mass incarceration, environmental destruction, pandemics, nationalism, and war. Even if the pandemic can be brought under control, even if an effective vaccine is eventually produced and made available to most people, the world capitalist system is now in the worst economic crisis since the Great Depression. The multiple crises of pandemic, climate change, and economic collapse will only intensify the competition among the largest imperialist powers, jockeying for position all around the world. Trump's racist anti-China tirades and the expulsion of US and Chinese journalists from both countries reflects sharpening contradictions that could ultimately lead to world war. To save lives, capitalism must be destroyed. The racist rulers will not go peacefully. We need communist revolution led by millions of workers, soldiers, and youth. Workers and young people are fighting back in growing numbers in the US and almost every country in the world. Whether we are fighting for food or jobs, against evictions or racist police terror, for gender equality or to unite with refugees and migrant workers, most important victory in any of those struggles is the growth of the revolutionary movement and the building of a mass communist party. Every day, PLP is fighting to become that party, capable of leading the working class to power with communist revolution. To do that, we have to learn from and win the confidence of the growing numbers who are fighting back in the face of the murderous actions or inaction of the racist bosses around the world. With every picket line, with every leaflet or N95 mask we pass out, we also bring our message: revolution is necessary. Revolution may appear impossible, but it is not. In fact, it may be inevitable. The difference between impossible and inevitable is the growth of a revolutionary party. Take that important first step. Join Progressive Labor Party.
All right. Can everyone hear me?
Yeah.
Cool. So that was the presentation. Thanks for watching. I would like to introduce several people to expand on some of the issues that were raised in the presentation. We have Catherine Pomerantz, who is a PL member and a happily retired librarian and public health educator from George Washington University School of Public Health. Catherine Connor, who is a linkage to care coordinator in New Orleans at a federally qualified health center there, and has a master's in public health from Tulane. And Linda Green, who is a retired physician in internal medicine and a longtime member of the American Public Health Association. I'm Layla, and I'm also a member of PL and their health collective. I'm a student, and me and a comrade will be asking some questions. So with the emergence of COVID-19 and other coronaviruses, which have been attributed to bats that carry the virus, and who then spreads animals and then humans. And amongst those humans in the US, there's a disproportionate amount of injury to Black and Latin workers, which also warrants explanation. How has capitalism played a role in creating this problem, and what would we do as communists now and in a future communist society?
Okay, well, I'd like to first address the question of coronavirus itself. The slideshow introduced the idea that deforestation and monocultural one-crop farming, genetically similar animals, and that sort of thing are some of the ways capitalism opens the door to biological disasters. Encroaching on previous undeveloped habitats for animals can lead to those emerging diseases and the spread of old ones like malaria. Genetic diversity is important to decrease these viruses getting a foothold in farms and animals also. Cutting back the rainforest for grazing and for mining, as in Peru and Brazil, has destroyed some of the canopy and led to more standing water and malaria in the Amazon basin. As communists now, we need to understand these processes and organize for alternatives while stopping the most destructive practices. One example is the World Wildlife Federation report card on the companies profiting from palm oil, for example. You may not know too much about it, I didn't, but palm oil is a major oil in the world. It outranks almost all the other vegetable oils, and it has led to deforestation that led to Ebola. In the report card on how companies have handled plantations and eroding forests and destroying natural habitats, the United States companies were never graded above a C. Most of them got Fs in the evaluation by that, and I think this is an example of an area where we could become more active. Regarding emergency viruses, there are some things we could be reading. Rob Wallace's book, Big Farms Make Big Flu, Laurie Garrett's books on emerging diseases are good starting points. We have some of these references in the information on the talk today. The contribution of these practices to climate change and future disasters and diseases, even as we deal with this particular pandemic, shows how urgent this is. For example, imagine the fires breaking out in California, as one of our friends mentioned the other day, in the setting of this COVID epidemic. How are we going to practice social distancing in that situation when people are being put into shelters and crowded conditions. So these types of things are things that as communists we have to become more involved in. But you also asked about the differential health impact on Black and Latin workers, and I just want to touch on this a bit. It's often discussed in terms of underlying diseases. While the chronic diseases exacerbated by the usual social determinants, or I would call them capitalist determinants of poverty, stress, education, and housing are important, it's critical that we not blame the victim as the pandemic is discussed. For example, when HIV was found to be prevalent in the Black community, there was a lot of attacking Black men for their behavior, everything from sex and condoms and drugs and the down low, none of which were more of an issue in the Black community than in the white community or anywhere else. An accurate analysis of the effects of geography, segregation, crowded neighborhoods, mass incarceration was totally left out of the dialogue for many years, contributing to stigma and blaming. As communists, we have to challenge any analysis that attacks communities of color for their illness, decreased life expectancy, or death from COVID-19. So capitalist profiteering in agriculture and deforestation has led to the presence of the virus, and the racism pushed by the capitalist class in order to divide and conquer workers and to increase their profits has led to the health outcomes we are witnessing today. So thank you very much. We'll move on.
Thank you, Linda.
Not a
I'm concerned about, people of color mainly, and their access to care, like testing sites and
Leila, please start over. You were
and
muted.
prevention.
Please start over.
Okay. Over the past few decades, funding for public health has been cut back and back in most budgets. I'm, as someone who's concerned for access to care for minority groups, especially with COVID-19 and the disparities in treatment and prevention and testing. What are the ways in which a Communist Party can approach public health going forward and after a revolution?
Hey, can you hear me? Okay, good. Hi, everyone. My name is Katie, and first off, my experience right now during COVID-19 is working at a federally qualified health center in New Orleans, Louisiana, where a lot of community health centers were created after Katrina to help provide access to care and expand that kind of access, especially after some of the hospitals were closed. And I think that more support and expansion for clinics like ours can provide access in communities and make it more accessible for minority groups and underserved populations. For example, we've been doing testing for HIV, COVID-19, and also continuing harm reduction services in the parking garage, where a lot of people were able to access them because we did not require drive-through testing, which a lot of the city sites did, so that people without cars could access care. So some of these, community health centers do increase access in this way. And we do think that you need to expand building more of them, as well as we're like one of the only states in the South that expanded Medicaid. And that really helped a lot with increasing access to care. So that would be another demand we would want, would be to expand Medicaid to other states in the South. Public health departments also need to be expanded to include the ability to gather data, contact tracing, and education for all providers. For example, in Prince George's County, there were doctors working at jails that seemed poorly educated as the pandemic progressed. In terms of jails and public health, the carceral state is also very detrimental to public health and in the face of a pandemic like this. So I'd also say we would need to abolish prisons and ICE detention centers as well to be able to appropriately attack a pandemic such as this and all of the other healthcare needs anyway. One of the ways that healthcare needs to be available is also for undocumented workers. We have tried to tackle that at our clinic by making sure there are people that speak Spanish, as well as not really asking for identification or insurance. And that, I think, has increased access for that community at our clinic. And there's been some things like in California where they also tried to expand access to insurance for that population. I believe that building trust with the healthcare system and with the government is necessary for people to feel like they can access care. And while we've tried to do that as a community health center, under the system, we don't have that trust. You can't expect people to have faith in, what the government is telling them when the government has been shown to not care about their health and to be openly racist. There's been interest in responsive areas like Kerala in India that has had more of a communist government since the 60s. Trust in the government and an extensive public health system have helped there with tracing cases, quarantine, food distribution. They were able to organize young people to go and check in on the elderly and help distribute food and things like that, which has gone, beyond the mutual aid groups that we're seeing, which are, great that they're popping up in the US, but a more widespread, buy-in to community health is needed. I would say that, the Medicaid expansion was great, but insurance alone is not enough. And we need a real healthcare system that reaches out with a wide range of services to address the social determinants of health, support for housing and transportation. These things all sound good, but it's a huge cost that capitalism will never enable. Too many public health policy workers are writing about what is needed, but don't understand that this dynamic of true public health and capitalism makes the goal untenable. Only a revolution with workers guaranteeing health equity can do this. Under capitalism, workers are only valued for the profit they can produce. So the capitalists are willing to let workers die who cannot contribute to this. Engels called this social murder. And we are seeing this today with disregard for the elderly or the disabled under COVID, and the meat packers in the Midwest and the health workers without personal protective equipment. As long as they have enough workers to make their profit, then they're fine with having many, many others die. Eliminating the profit system will give all workers an opportunity to live healthy lives and to build a society where crises like this can be handled collectively. Thank you.
Great. So as we've been discussing, the multifold failures of capitalism have been especially laid bare by this coronavirus epidemic. We've completely failed to support workers and their families, and that's especially disproportionately affecting Black and Brown communities. But the other epidemic that has been going on is that of racist police violence, which is very obviously still with us. Despite at this point several years of Black Lives Matter activism and massive protests, we are seeing it boil over again right now with the murder of George Floyd and Ahmaud Arbery and Breonna Taylor and countless others. And so now subsequent, anti-racist, anti-police protests have erupted in Minneapolis and obviously around the country. So what steps can we take to encourage, support, and amplify these efforts for revolutionary change, especially given the ongoing pandemic?
Oh, quite a challenge. But first of all, we should have a shout out to the protesters in 75 cities around the country, which is really phenomenal and very multiracial and very militant. So good for all of this for the future. We know that racism is the most significant problem with public health in our society. Even the American Public Health Association plans its next webinar as Racism, the True Underlying Disease. communists have organized for multiracial unity for a long time in anti-lynching campaigns, union organizing, strikes, housing, jobs, evictions, police murders, and immigration justice. Black workers in the Soviet Union in the early years after the Russian Revolution were amazed at the lack of racism in this communist society. We have to win workers to build a mass multiracial movement against capitalism at both the local and the national level. The protests in Minneapolis, Ferguson, and Baltimore have all had really strong elements of this future, but we need to attack the capitalist institutions and policies that drive racism and win people to understanding what that means. Racism helps the capitalist class by dividing workers, which of course hurts us all. And at the APHA, which has about 30,000 members, we tried doing a campaign for about how law enforcement violence is a public health issue. And after 3 years of struggle, rallies, rewrites, and conversations, this passed in 2018. And you can see this resolution at endpoliceviolence.org. And I would encourage people to use it to explain both how public health is a much better solution than police to all kinds of problems, including wearing masks under COVID-19. We were helped in that campaign by many groups, including Critical Resistance and Health Impact Partners, and it became a very broad issue. So you have an organization with 30,000 members, and you can really attempt to get into people's minds and hearts around an important issue like police violence. Some of the schools of public health also came out with policies around this, but not all. There's still a lot of work to be done. Locally in Maryland, we have partnered with organizations and focused on attacking the prisons and police brutality for 40 years. I want to speak briefly to West Wednesday, which is a campaign that has gone on for 6 years with a rally every single Wednesday in Baltimore. Tawanda Jones's brother was killed in much the same way that George Floyd was killed, by positional asphyxiation after a simple traffic stop. And every week for 6 years, she has led a rally. Currently, they're virtual. You can find them on Facebook under Tawanda Jones. And every Wednesday at 6:30 Eastern Time, you should check it out and bring more people into that campaign. This is the kind of long-term, serious struggle that we will need in order to make a revolution in this country. Currently, our work in the DMV includes organizing with community justice and life after release. This has involved car caravans against police murder, court watch, participatory defense, where we try to get people out of jail or at least a better deal, and certainly not giving in to every single plea deal that the prosecutors ask for. We also are studying about mass liberation instead of mass incarceration, demanding that ICE and immigration detentions be closed with groups like Close the Camps and CASA. Doctors for Camp Closure is a small one. But despite all of these things, even more important is our focus on levers that can shut down the city and make real demands. Organizing among transit workers offers the possibility to demand not just wages and benefits for workers, but also social changes like rent cancellation, no evictions, and expanded unemployment benefits. In Minneapolis, bus drivers went on strike to demand the arrest of killer cops. In New York and Minneapolis, they refused to transport protesters when the cops arrested them. Community outreach, direct action, strike solidarity, such as support for the sanitation workers in New Orleans, and webinars can build our base. In addition to these activities, we also do some writing. Progressive Labor Party has a newspaper, Challenge Desafio, and we have study groups on Marxism and revolutionary theory going on in Washington, D.C. and Maryland. There's a multiracialunity.org blog that some friends have written, which is in the list of resources and comes out with something just about every week that talks about how to build the movement. In our study groups, we attempt to advance the line of working class solidarity. Quite importantly, the elimination of wages and sharing from each according to one's ability and commitment to each according to need. As we engage in all these anti-racist activities, we try to build the Revolutionary Progressive Labor Party. Without the conversations and close ties with friends, co-workers, and neighbors, we cannot have the power to eliminate capitalism, and any of these reforms can be taken away. voting, electing Black and Latin politicians, and praying do not change the structural problems and have done nothing to reduce police violence over centuries. We have seen how the gains of unions and the civil rights movement have been chipped away by the capitalists. We need to have the working class in power in order to maintain our victories and carry them forward. Thank you.
So we have one final question that we'll sort of be discussing now. I believe Karen's going to be answering that. So capitalism, which is a profit-centered system based on exploitation, is fundamentally incapable of equitably and morally allocating resources in order to protect a society during any type of crisis. Inequality obviously existed long before this pandemic, but the pandemic is exemplifying it and exacerbating it. So why is communism the better system to improve quality of life, to prevent and control epidemics, to eliminate these health inequities, and how do we achieve it? Like, what does that system look like?
Thank you, Sai. And hello, everybody. Hello to old friends and to new friends. It's obvious from our experiences over years and this week and the issues described above that capitalism does not work for any of us. It is intentionally racist and oppressive. And people are kind of coming around to thinking about different alternatives. And some people recommend anarchy, democratic socialism, widespread collective ownership of production as well as consumption, voting for the evil lesser of two evils, and other ways to reform the system like enacting universal health care and prison abolition. But with the United States playing do-it-yourself pandemic control, many of us are realizing the usefulness of a structure that is centralized for decision-making and communication with input from public health advisors and the public. So as we've talked a little bit about, the failures of socialism in China and the USSR has made many people think that communism, which sounds so good, is an impossible dream. But these countries' experiences also gave us many lessons we can avoid so we can establish a communist government that is equitable. I'd like to offer several components about what that would be, how communism is a significant determinant of health and well-being for the working class. So a few points. Number one, there are no wages that stratify people into high-income, high-status jobs and low-income, low-status jobs. So there could be much more social inequality and a lack of hierarchies. Everybody would contribute according to one's skills and interests and commitment and receive housing, healthcare, education, more leisure time, and other necessities. Leaders would lead with more responsibility and receive no privilege or swag in return. There's also no division between mental and manual labor. And while scout work certainly will exist, there'll be more equitable sharing. So in China during the 50s, doctors were actually expected to mop floors, and housekeepers were expected to join the medical team to round on patients and offer their insights. And everyone has value. I think that's really important. Everybody can and wants to and will contribute to society, and their contributions will not be diminished by their gender, their age, their abilities, sexuality, nationality, citizenship, or racial constructions. During academics, these governments organized massive outreach campaigns. Katie mentioned about Kerala, and where people were also mobilized to provide emotional support to people, elderly people who are quarantined. So these people actually receive phone calls every day as checkups. And China organized 11 million volunteers to pick snail vectors out of the riverbanks because they cause schistosomiasis, one of those worm diseases that reduces fertility. And they were successful in eradicating it for them.
To be clear, the United States absolutely could have the resources to pull off programs like that. The United States is the richest country in the history of the world, And instead of using that wealth to make sure that all of our people are fed right now, that our healthcare workers have adequate personal protective equipment, that there are enough ventilators to go around in hospitals, we've instead chosen to spend that money and those resources on militarizing the police so that they can harass people of color both domestically and abroad. We produce, weapons and fighter jets instead. We've only deployed our National Guard to harass the protesters in Minneapolis instead of doing anything remotely productive with that. So it's a question of priorities, not of resources. And a capitalist society can never have the correct priorities.
Right. Absolutely. And that argument about having too much population is bogus as well, because we could feed the world. So the point number 2 I want to make about what a communist society looks like is that there's no private property. Like there's no idea that people, corporations can own land, air, water, natural resources, and now space. And there's no exploitation of people's labor in order to make a profit. So that really removes the need for racism and sexist practices because they create super profits and super oppression under capitalism. In China, Katie talked about how women became more, or the slideshow discussed women becoming more independent, and they also became leaders. Number 3, unless Sai has comments.
I did want to jump in on one thing there, which is that Black people especially, and also young people, very rarely own private property under this capitalist system of super exploitation. And so currently that means that most of us have no choice but to rent, which obviously depletes our potential to have savings to be able to weather an unexpected crisis. And now that means that any one of us is liable to be kicked out of our literal homes during a pandemic with absolutely no recourse. And without a nationwide eviction moratorium, we are most likely going to see a lot of evictions in the near future. And that is going to be something that we need to begin to organize around.
Right. And actually, during the 1930s, during the Great Depression, there were a great deal of evictions. And the Communist Party at that time organized these unemployment councils. And they actually sent hundreds of people to homes where people were being evicted, and they moved the furniture back in. And in one place, they were able to stop 77,000 evictions in 1 year. So these things are doable when people are organized. And that brings me to the third point, which is working class power. It means the working class really controls everything. People would belong to the party, which I hope is ours, to determine health policies and priorities like infrastructure projects. Do we really need more highways, or do we need mass transit? How many hospitals do we need? How many healthcare providers do we need? How do we produce food? It would be based on current needs as well as future needs, because we won't be thinking about making a short-term profit. We'd be making, as somebody said on another webinar, it would be just in case production and supplies. So in the Soviet Union in the early days, they actually mandated vaccinations, and everybody had to get one. And the government, the public health agencies would go to the people to provide this. And they were able to eliminate a lot of epidemics and infectious diseases. After the Soviet Union collapsed, people began a movement against vaccination. They had their own anti-vaxxers, and they saw developments of like diphtheria epidemics that had been stopped for decades. We also recognize that Cuba has prioritized public health and medicine, and still currently trains thousands of doctors to utilize at home and abroad. So it's not going to be utopia. There will be times of abundance and scarcity, but they will be shared. And groups who are most exploited under capitalism would receive more to increase equity and to enhance their health, as well as others. And if there are any comments, I'm sorry, I can go on.
No, I think you can go ahead.
Okay, so my last point, well, second to the last, is about values and ideas. You know, we're just immersed in individualism in this country, and we're immersed in the idea of personal responsibility responsibility. What we want to bring forward and enhance is social responsibility, collectivity sharing, and community-based approaches where everyone benefits. When the most exploited people benefit, that anti-racism benefits the entire society because everybody could contribute to it. So it's a win-win situation.
It also is a fallacy that people will say in times of crisis, human beings start to compete more, they're more animalistic, and they won't cooperate. In fact, I think you often see in spontaneous cooperative movements that the opposite is true. I saw recently that many of the goods that were looted from that Target in Minneapolis actually were organized and left out by people so that protesters could have access to milk and food and water and that kind of thing. And that was spontaneously organized. And I think that is really the type of spirit that we need to move forward with.
Right. Wow. That's good to know. So the last question is, how do we do this? How do we overthrow capitalism? And I think we need extensive political education to begin with. We need to know our history. We need to know about political strategies and theories. We need to drill down to how do you control an epidemic and enhance public health. So it all really boils down to winning the hearts and minds of people, because if we're not committed to these values and practices, it really can't happen. So people must have strong political will. They must be strongly anti-racist, and they must have a commitment to making the revolutionary sacrifices as well as victories. And so even if we succeed and establish this kind of society, it will take a long time and a lot of effort to build trust and multiracial solidarity. But I think we can start, as everybody has said, by building a party that includes workers all around the world, as well as soldiers, because we'll need them desperately. And we invite you to join. So we have a study group, as Linda said. We have a newspaper. People can engage in organizing, around different issues. And as others have said, we'll post the some of the recommended readings and activities after this. So thank you.
Yep.
Okay.
And I guess with that, we would love to take questions and comments from the audience.
Or if you want to, tell us what you're doing in your areas.
I guess while we wait, one last thing I just wanted to add is I am seeing more of the kind of woke liberals starting to engage in conversations than I have seen in the past, even around similar issues. And so this may be the time to stop avoiding having those difficult conversations and really confront it head on, that police violence is related to so many more factors than just one. And maybe we can capitalize on that.
To use a phrase.
To use that phrase.
Let's see. It's a good question. So how do we evaluate the current demonstrations? What are their goals? I guess everybody can see this, the role of violence in multiracial unity, and the potential for making more revolutionary communist change. So who would like to answer that? Not to pick on anybody, but I know Katie has gone to a lot of these demonstrations. Do you have any one answer?
Well, greetings. I wanted to just congratulate you on excellent work that you've been presenting here today. And I did want to ask you about how we best go about linking this coronavirus and the pandemic and the incredibly botched approach to it that seems to go with the capitalist system with the incredibly vicious police brutality that's been going on. And so I'll give you a second to think about that. And in the meantime, I want to mention that tomorrow at 5 o'clock, Community Justice is having a rally at Eastover Shopping Center at 5 p.m. to try to bring more people into the circle of very woke and conscious folks who want to take on this fight in a long-term way. So, and that's it's near Indian Head Highway and Southern Avenue. But we'll, if you need more information, we have that posted, I believe, the actual address that you can then navigate to when you want to actually put it on your phone. So, what do you think? What's the connection between the virus and the response to it and the police brutality that we're seeing right now? I mean, I do have some thoughts about that, but I'd like to hear what Katie has to say.
Well, also, Rod, maybe stay here. I mean, this was a lot of questions that were just posed very quickly. So, I mean, I would say that in terms of the direct actions that are happening right now, I mean, I think people do need to be prepared, and I think there needs to be, you know, serious discussion before people go out to the protests about, you know, what are you willing to be engaged in, and you know, making sure that you know, bring the right stuff with you. And, you know, I've seen stuff about turning off the location on your phone, things like that. But I think that, you know, there needs to be serious discussion with people about, you know, what might happen and how it should proceed. I think a lot of the organizing about, you know, getting protesters out of jail and raising funds for that, and making sure people have like the right phone numbers and everything, is really good. And I do think that the incredibly strong presence by the police that we've been seeing with tanks, you know, residential streets in Minneapolis is pretty scary. But I think that it shows that these multiracial movements are a huge threat. And so I find that encouraging when they do these, you know, really strong opposition to us. I think it shows that we do have power and that they are worried. I think, what was the other question?
Well, how does all that link in with the pandemic and the botched response to it that is killing thousands of people in the United States, say nothing of what's going on in the rest of the world?
Yeah, I mean, I think that the response to the pandemic in the US showed, you know, how devalued life is, particularly working class and Black and Latinx life. And that police brutality also demonstrates that on a regular basis. And so, I mean, I think that they are worried that with the pandemic, a lot of people are realizing, you know, the big fractures in society, and it's exposing how capitalism really screws everybody over. And so I think that the anger about the pandemic response, and then coupled with the anger about police brutality, I think that they can be worried that, you know, we're on a cusp of society of like maybe some real change really happening, because people don't have jobs and because people are getting evicted and are realizing that there is no safety net under this capitalist society. And so I think that it is, you know, spurring action in a way that, you know, we haven't seen as much before. And so people that are struggling with the pandemic and maybe not being able to get food and realizing, you know, that their jobs don't care about them and are trying to make them work in unsafe conditions are also, you know, being able to use that towards, you know, attacking the police system as well.
Yep, I just wanted to hop on and add really only one main point, which is that we have seen literal trillions of dollars going towards the stock market over the past several weeks. We have heard that billionaires have gotten $434 billion richer, while 40 million people are out of jobs. And it's pretty obvious to all of us that that is white collar looting. And I think it is really, really difficult for them to be able to look us in the face and tell us that it's really such an issue when people steal a few $1,000s worth of goods out of a Target, when that is the broader picture that's going on here. So I think what we're seeing right now with the protests really going on at the level that they're going on is a combination of obviously being extremely fed up at this is the third extremely high profile police brutality case that has happened just in the last couple of months, but that on top of recognizing that Black and brown workers have been disproportionately affected, that something like 80% of Black workers cannot work from home, so they're already having to expose themselves to this disease more. It's just a systematic devaluing of their lives.
I would also just add one last point, which is that I think that when they talk about, when Trump and these other leaders, so-called leaders, talk about looting and burning and all of that, I don't know where they think they have the right to say a damn thing about any of that when they have created the system that inevitably creates death and destruction for the working class. I think it's about time that we get a little bit more action to take on these bosses and not so much worry about their private property. Thank you.
Okay. Someone asked a question about what are we going to do about the eviction crisis, which is coming down the road over the next couple of months. I think the May figures in terms of rent payments, like 40% of people in this country did not pay their rent in May. And those numbers are probably going to grow over the next couple of months because of the massive unemployment and the minimal unemployment benefits. The extra unemployment benefit is actually supposed to end in July, so the crisis will even deepen. Well, in DC, there's a DC tenants union which is organizing people to not pay their rents to create solidarity. And I know in several buildings, particularly in the Adams Morgan, Columbia Heights, they've got like 25, 30% of the people in the building refusing to pay their rent. So to the extent that we can expand that base, it becomes impossible for the capitalists to evict everyone. I mean, basically, they can't evict tens of thousands of people in Washington or any other major city. Where are they going to put them? It's only to intensify people's willingness to rebel. The second point, as I want to make, is to change things, you need to have a source of power. And that source of power is the working class. And if you notice in most of these demonstrations, unionized workers like transit workers, UPS workers, hospital workers, other communications workers are not participating in an organized way. And that's a weakness. If the organized sections of the working class in key strategic industries begin to participate in these rebellions, we can have real power to force change. And to sustain that change for the long run, we need a revolutionary party to hold that together, to move it to a higher level of political consciousness, and to bring down the capitalist system. Those are, as we began in the beginning, we said, those are possibilities, but they only become realizable when you have actual organizations which are made up of people committed to that struggle. So I know 70 or 80 people signed up for this podcast today. I don't know how many actually are listening in, maybe 2/3 of them. But those people, I know we don't have anywhere near that many of people in the Progressive Labor Party in the Washington area. So the time now is to join up, help us plan for the future, help us build this organization which can try and bring down capitalism once and for all. These opportunities only occur rarely in our lifetime. The Depression, the Communist Party of the United States grew to 100,000 people. The 1960s, leftist groups, our party, other leftist groups, grew to tens of thousands of people. But unfortunately, because of weaknesses of our line, of our practice, we were not able to sustain that. We should learn from the mistakes of the Depression era. We should learn from the mistakes of the 60s and rebuild a revolutionary movement which can actually succeed in bringing down the capitalist system. It's an opportunity. Some of us older people may not be around to see it, but you younger people, you got a real chance to change the world, and you should commit yourself to that struggle. Thank you.
Okay. So do we have anybody else? Let me look at the rest of these questions real quick and see if you're going to bring anybody else up. Someone asked if they can access the recording later. Yes, you will be able to access the recording. If you signed up, the recording will be up for a while. We'll also be posting it on our YouTube channel and on our Facebook live feed. Let's see. So Rod, is there any, or Katie, is there any organizing around direct action right now? Hold on,
Tomorrow at 5 o'clock.
Start over.
And that's going to be over at in Oxon Hill off of the Southern Avenue at the shopping center, Eastover Shopping Center there, 5 o'clock. And we're going to try to reach out to a lot more people from the basically the underserved sections of the working class who live near the Eastover Shopping Center. So that's one step. And then, of course, we also have a study group that's coming up this Wednesday. We're going to be discussing fascism and social revolution. And if you're interested in any of that, just get in touch with us. But we'd love to see you tomorrow at 5 o'clock at Eastover Shopping Center.
Okay, so all of this information, I'm going to post it in a few moments in the chat. And it will also be in the description permanently. So Karen wanted to talk about looting.
Yeah. Also, Sean, I was going to say in terms of actions in New Orleans, I think they're doing, we had a lot of rallies yesterday, and then I think one of the main groups organizing down here is doing something every day this week at like 5 p.m. at City Hall. So
okay. That's good. I'm going to bring Karen up. Rod, I'm going to knock you out.
Okay. Yeah.
Yes, Karen.
Hi. I just wanted to read a quote from James Baldwin that's been making the rounds today. This was an interview in 1968, and it's Esquire magazine. And the reporter said, "How would you define somebody who smashes in the window of a television store and takes what he wants?" And Baldwin replied, "Before I get to that, how would you define somebody who puts a cat where he is and takes all the money out of the ghetto where he makes it? Who is looting whom? Grabbing off the TV set? He doesn't really want the TV set. He's saying, screw you. It's just judgment, by the way, on the value of the TV set. He doesn't want it. He wants to let you know he's there." The question I'm trying to raise is a very serious question. The mass media, television, and all the major news agencies endlessly use the word looter. On television, you always see black hands reaching in, you know. And so the American public concludes that these savages are trying to steal everything from us. And no one has seriously tried to get where the trouble is. After all, you're accusing a captive population who has been robbed of everything of looting. I think it's obscene. So that may be a good thing to share with people.
Yeah. Okay. So we can't do anything about the connection quality. If she's breaking up, there's not too much that we can do about that. It's the internet, unfortunately. But let's see if we have any other questions that does anybody have any further questions that I've missed so far? If you do, please repost them in the chat. And Karen, would you be able to post what you were just talking about in the chat as well? Okay, thank you.
Yeah.
Okay, so on June 14th, we're going to be having a discussion that is, I'm not sure what platform we're going to be using. We're either going to be using Zoom or Crowdcast, which is this platform again, or possibly Google Hangouts. But we're going to be talking about revolution, communism, and the party. And so can we just...
Yeah, there's a question from Teresa.
Yeah. So can we discuss the looting of small businesses with a critical lens in regards to property? Did you want to answer that, Karen? No.
Not necessarily.
No. Okay.
No, but somebody else may.
Katie, you want to answer that?
I'm typing.
Yeah. All right. Well, I mean, we were talking about small business owners. It's really, I mean, it's like people are being exploited and robbed their whole entire life, and then people get upset when banks and other businesses are looted. And if you really think about it, if you're being exploited your entire life and then you decide at some point that, okay, I'm going to take what should be rightfully mine anyways, I'm going to take what I need basically, or whatever I can to help myself survive based on the conditions that are around me. I mean, it's first off, most businesses are covered by insurance in one form or another, and they make a living off of exploiting other people. So if they get robbed, I mean, okay, so what's the big deal? It's just property. It's not like they're out there murdering people like the cops are every single day of the year on a constant and consistent basis. And I mean, people are, subjected to dramatic consequences of racism. I mean, how would you define somebody who takes what he wants and someone who's doing what they should? I think that's it. Yeah. Okay. So it's I mean, when we're looking at Sai, you want to come in? Okay, let me get a little bit of a clearer perspective here.
I think we are very on the same page. It's not just those individual businesses themselves that are taking the hit, it's their insurance companies that are taking the hit. Right. And please let them take as many hits as possible, honestly. Last night in DC, it seemed like most of the ire of protesters who were breaking windows and stuff were directed at like the Ronald Reagan Institute, the Department of Veterans Affairs, like a Citibank, a Bank of America. And I felt like that was definitely a great target for, obviously, I mean, if you're going to break some windows, let those be the windows. But also definitely like a couple of liquor stores and everything. And I definitely had that moment of, oh, that's unfortunate. But at the same time, exactly what you were saying, it is going to be on their insurance. And I think someone mentioned in the chat that like Penzies, a spice company, said something about, you know what, no, it's fine. Like fighting racism is more important. There was an Indian restaurant in Minneapolis that said exactly the same thing. Our building is gone, but we will rebuild. The fight for justice is so much more important than our building. And honestly, I have a very strong feeling that the businesses that have been important to the community, that have engaged with the community in a respectful way, are the businesses that the community will help rebuild when it's time to rebuild. But at the moment, this isn't just, senseless violence like all police violence is. It's rebellion to make a point. And I think that point, that anger that's being expressed is so much more important than any property damage that's happening. And I think that a lot of that rhetoric around, oh, it's hurting small businesses is just deflection. It's trying to paint the protesters as being deserving of the police violence that they are now being subjected to. I mean, police driving into protesters, like I saw a young Black couple in Atlanta getting tased and yanked out of their cars, journalists being arrested live on TV. I mean, the amount of tear gas and flashbangs and rubber bullets and all of that, I think they're amplifying this, oh God, you're hurting small businesses. You're not hurting small businesses. The pandemic has hurt small businesses. The government's refusal to provide support to small businesses is hurting small businesses. A few broken windows is so not the issue.
Yeah, I agree completely, Sai. I mean, you said it all very well. I think that it's also been so blown out of proportion and focused on every time that there's a protest or anything, it's all they show on the news. It's insane. I'm like, it's got to be like 2 businesses or something, and then they make it seem like they just burned down the whole city, which the government has bombed entire cities before. So the whole thing is like ridiculous, but I agree with everything you said.
And I just wanted to address, you're right, police violence is not senseless. It does have a purpose. It is directed and focused to subjugate, absolutely, and to maintain power for capital and white supremacy. totally right. I meant senseless as in it's like disgusting and unjustifiable. But yes, you make a very good point there. Yeah.
So, do we have any other questions that we missed or didn't address? No? Okay. Well, thank you all for coming. I feel this is a really good presentation. So I'm gonna end the broadcast and leave the chat up so if people want to chat for a little bit. I'm also going to post upcoming events and all the links in the chat. They will also be in the description. So thank you all for attending, and hopefully we can work together and build and change society as a whole for the better for everyone. Power to the working class. Thank you all. Have a good day.
Thank you all.
Thanks.